Hi guys, it's Sarah Norwood here to continue my functional neurological disorder journey series, where I will share every week something that I've learned about this brain disorder, because I'm going through an 18-week non-epileptic seizure clinic program. And also, I've probably had this for a couple of decades, but we just discovered that this is what I have on July 4th of this year, when I had a full-blown functional seizure for the very first time. So what I wear out in public is my hidden disabilities medical card. The reason for this is people that suffer from this brain disorder oftentimes can have what looks like epileptic seizures or blackouts or full body paralysis out in the public. And sometimes we can't speak when we have an episode. The issue with this is oftentimes people will call 911, and the EMTs and the doctors will have no idea that it's actually functional neurological disorder and not a stroke or epilepsy, and they may give you the wrong treatments, such as an epileptic medicine or a stroke medicine, or if you're having trouble breathing, they may, want to incubate you, and all of these unnecessary treatments, can happen if they are not aware that you actually have this disorder. So on my card, which I got off of Etsy, because Australia and UK and other countries are far ahead of the US as far as education and awareness of this brain disorder. But I got this off of Etsy from a woman in Australia that makes these cards so that if we have an episode out in public, there's a space here that has 2 emergency numbers that the people in public can call. And also it talks about what's going on and the symptoms. So let me just read this. It might be helpful for some people. And even if you don't have FND and you have a hidden disability, there are tons of different types of medical cards that you can wear in public. So what it says is, this is an FND awareness card, and it says, "My name is Sarah Norwood. I am suffering from functional neurological disorder, or FND, which is a medical condition in which there is a problem with the functioning of the nervous system and how the brain and body sends and or receives signals. I need you to be patient with me. I need you to be patient, speak clearly to me, and if I have a seizure or blackout, clear the area to make it safe. I will not need an ambulance as long as I am not injured." Now this, in some cases, it could actually be a seizure or a stroke. So even if you have this, if the people in the public environment don't feel that you are safe, they still should call 911. It's always better to be safer than sorry, because a lot of people with FND actually do have epilepsy as well. So epileptic seizures and non-epileptic seizures. But in my case, since I've had the testing done and I don't have epilepsy, this is what I would hope somebody would read and understand. It's okay, just get me to a safe space where I can't hurt myself or be hurt, and I will go through the seizure and I will be okay. The symptoms of FND, the signs and symptoms. So sometimes you can have full body paralysis or limb paralysis. You can have limb weakness, where there could just be like for me, the left side of my body is very weak. There could be seizures or full-on blackouts where we completely pass out. Seizures that look like epilepsy, where you can get, dystonia and T-Rex arms and eyes going back, rolling back in your head. It can be very scary for people around you to experience or witness. You could have walking difficulties. Oftentimes, people with FND have a cane, a walker, or even a wheelchair, especially after seizures or episodes, because our brains are trying to tell our legs to work, but oftentimes they don't work, sometimes for hours afterwards. Other symptoms of the FND are spasms and twitching, which like a lot of times I'll twitch like that. I'm just showing a pronounced example of it. Sensory issues, speech difficulty. Oftentimes before I'm about to have a seizure, my whole right side of my face droops. It looks like I'm having a stroke, and I will start stuttering, and I can't speak. So not being able to speak is why these cards are so important. Loss of balance. Sometimes for me, I will just all of a sudden start walking to the right or the left and bump into something or fall down. Vision problems. I've gone blind completely in my right eye during an episode, or I see black spots, and a lot of people can show up at the ER blind and paralyzed from FND. You can have tremors and memory problems. Sometimes if I have a bad seizure day, I can't remember chunks of that day. So those are just some of the signs and symptoms and what it is. It's basically a disconnect or trouble with the signals, the software of the brain, trying to send or receive signals to the body. Now the nervous system is involved as well. So FND is very nuanced. It's complex. It's different for everybody. So, a lot of people are like, how did you get FND? Well, a lot of times we have it for decades before we're diagnosed, and we're misdiagnosed with about a zillion different rare disorders. But most of us have some sort of autoimmune issue, but it can be from childhood trauma. It can be from a car accident. It can be from major surgery, anything that jolts you and causes the software of your brain to be disconnected or discombobulated. And there is treatment. There are different skills you can learn, and awareness of your triggers, your internal, your external triggers. It takes a lot of work. It's a process. There's no cure for it. It's a lifelong disorder, but I don't want people to give up, because let me tell you, when I started first having full-blown seizures this past year, the depression and anxiety is just huge, because you're isolated. You're afraid to go outside and leave the house because you're afraid you're going to seize. Or in my case too, I have a movement disorder. So sometimes I have vocal tics or trunk tics or facial tics, and it's very embarrassing. So it's very isolating. But every week I'm going to share with you any tips and tools that I learn to help you. And also, you're not alone. You're not alone. More people suffer from this than are diagnosed because of the lack of education. And even real, doctors and even neurologists, some of them, because there's a psychological component to it, don't take it seriously. And there are some people that are shamed when they have a seizure because they're told you're making it up or something. But this is subconscious. This is very real. The pain is real. The movement you can't control. It's involuntary. So it is real. I believe you. There is hope, and we just got to stick in this together. All right. You take care, and I will see you soon. Mwah! Hope that helps.